It's time to focus on the things you need, the things you deserve. You deserve a healthy body, supplements that get you moving and keep you moving, that make you feel good, look good, do good. And they shouldn't contain GMOs, artificial ingredients, or heavy metals, ever. Supplements that are clinically studied, use proven absorption technologies, are designed by scientists, and are ethically sourced and produced. Supplements with everything you need, nothing you don't. You deserve a company that you can trust, that's dedicated to safe manufacturing practices and third-party testing, that ensures the highest quality of effectiveness from extraction of ingredients all the way to the composition of the packaging. Wait a second. You deserve to see the process. You deserve a company led by a CEO with a deep belief in the power of people, dedicated to inspiring entrepreneurs to achieve success. A company with a phytonutrient chemist and expert on natural molecules who is obsessed with human health and has your best interest in mind to design its products. A board comprised of talented doctors from around the world. You deserve to be surrounded by people you trust and look up to. Empowered ambassadors that inspire wellness every day. Leaders who are rooting for you to be the best version of yourself. A community that works hard and plays hard. You deserve to experience adventures that take you around the world, and you deserve to be recognized for your hard work. It's time to get what you deserve. It's time to shift your focus. 3.
Hello and welcome, my friends. My name is Adrianne Carbonell, and I am tuning in all the way from Austin, Texas. And it is my pleasure to be with all of you guys tonight. We have an incredible lineup. We've got an amazing orthopedic surgeon on. We've got 3 incredible guests. It's going to be a great night. So if there's anybody that is sitting on the fence about 3, make sure you send them a quick text message and remind them to jump on right now, because you are not going to want to miss all the incredible information from tonight's Wellness Wednesday. And yes, this is a global Wellness Wednesday. So welcome from wherever you're tuning in the world, whether it's morning or evening for you. All right, so I am excited. Truly, 3 changed my world 2 years ago now. We're still just a 2-year-old company. We specialize in 6 ingestible ingredient supplement lines that are absolutely amazing. It's proactive wellness with a specialty in absorption, right? Doesn't it make sense that you'd want your supplements to absorb, right? You don't want to waste your time or money on things that don't work. You want things that work, and that is exactly what sets 3 apart. We also have an incredible skincare line that is in the neurocosmetic field, which is an emerging market really about the skin-brain connection, and we've got it. So that's pretty incredible too. So you can count on 3 to always have the best of the best, and that's a true testament to our formulator, Dr. Dan Gubler, who's had 17 years of experience. He's got 16 patents granted and are pending. His PhDs in organic chemistry. He's Caltech trained, and you can follow him online. So you guys can Google Dr. Dan. But for tonight, we have an amazing health professional and doctor who is going to be sharing his experience as to why he said yes to 3. And then stay tuned, because we've got 3 incredible testimonials. So I am going to be introducing Dr. James Lee. He is a board certified orthopedic surgeon. He specializes in sports medicine as well as knee, shoulder, and fracture care. And he's got an expertise in joint replacements for the hip, knee, and shoulder. And so he's really known for his patient-centered approach. Dr. Lee combines personal care with advanced treatments to really help restore mobility and enhance the quality of life for his patients. And he is out of Paramus, New Jersey. So please help me welcome Dr. James Lee. How are you tonight?
Doing very well, Adrian. Thank you. Glad to be here.
Oh, I'm so thrilled that you had time to be with us tonight. And
It
I know
worked out.
yes, you and your beautiful wife, Asha, love the products. And so I just want to hear a little bit more about you. What made you become an orthopedic surgeon?
Oh, thank you for that question. My father is an orthopedic surgeon, so I'm second generation. So at a young age, I was able to shadow my father and be mentored by him. And I have a mom who was a nurse. So my family is very much into healthcare. So the influence started early. and it took. And so I started observing my dad, and he really loved what he did. It rubbed off on me, and as I, went through undergrad and medical school, it's something that I pursued. And 17 years in practice, it's something that I truly enjoy, and I'm glad I was able to start this career. And about maybe halfway through, who knows?
You just never know, right? Taking
Right.
life one day at a time. But wow,
Yeah.
what an amazing experience. I did not know that your father was also a surgeon and your mom was a nurse. So yes, you have
Yeah,
a family that understands the value of having good health in their life. Um,
absolutely.
so how do you value your health? Like what are things that you do? I mean, you must see patients all day. What gets you fired up about taking care of yourself too?
Sure. I value health. The way I manifest it is exercise, diet. My wife Asha, she is very much into health and wellness, and I think, being married to her, I certainly have benefited from her influence, and then just, learning about health in general. As an orthopedic surgeon, the focus is surgical, not so much nutrition, and I think that's something that, I've learned more about. I've educated myself. Certainly being a part of the three world has helped a lot. And then when I look at my patients, I'm able to offer them more than just a surgical options. You and I talked the other day, and any given day, I'll see 30 patients. Five of those patients are surgical candidates. The remaining have joint pains and aches, muscle aches and pains. And it's like, okay, well, how would I treat them? And I think about what would I do for myself? And so my thoughts are, what's a natural way to, help them with their pain, something that most likely won't interfere with their medication, and it's something they can, really, really take and help, both short and long term. And it's something that I can say, listen, I take this, it helps me. 5, 6 years ago, I didn't know anything about this, and it's certainly, and I'm talking about three, and it's really helped me with my own health, and it helps my patients too.
Yeah. And I know you've had kind of your own personal journey on three as well. Do you want to share with us a little bit about how the products have been working for you too?
Yeah, I would say the what got me hooked, if you will, is I hurt my knee about a year ago. So I coached my daughter's like recreational basketball team, and I was unfortunately demonstrating in a game, and I tore my tendon in my knee. So it wasn't the best day of my life, but I ended up having surgery and recovering, and I'm doing fine now. But I remember one particular incident where I was in an auditorium at my daughter's sixth grade graduation, and the room was cramped, and the little chairs, as you can imagine, and feeling tremendous knee pain. And I'm telling my wife, I usually don't complain, but I was mumbling to her that my knee is killing me. And she had just started her three journey, and mentioned the Revive product, which is a natural supplement that has turmeric, ginger, shiitake mushroom, black pepper. And she's like, I think you should try this. It might help you with inflammation and pain. And so I was skeptical, I have to say. I was like, no way, I know what I'm doing to my knee. But I ended up trying it, and I couldn't believe how good I felt the next day. And I am not lying. I felt really good. My knee pain was completely gone, and I was hooked. I was so happy, and realized that this is something that's natural, it's healthy, and it really made a difference. And it's something that, how I use it now is if I have a heavy workout or a long day in surgery, and I feel like I'm going to be sore the next day, if I take Revive, I usually wake up not having to, take those ginger first steps in the morning, or like be hunched over. It's usually waking up pretty good. And I'm somebody who's, close to 50, and, going through, the age-related changes that happen. But I think this has really made a difference for me, and I use it in my practice too.
Yeah. That's an amazing story. Like for you to know what knee pain feels like, and certainly you hear about it all day long, and then to have your own experience with it and to go take a natural supplement
Yes.
versus like I'm sure it wasn't your first go-to. Like, oh yeah, let me take this natural supplement that my wife
Yeah.
just bought, right?
Right. Right. Yeah. I was prescribed, after the surgery, I still had, the heavy dose medicine. I had like ibuprofen and Neurontin and all these, fancy medications that are still in my medicine, chest, and I didn't use them. I initial use, yes, but I didn't want to continue to take them. And so this was like, wow. And knowing that I could take it continuously, and just benefit, or all the more better.
Yeah, absolutely. That's really inspiring because I think sometimes we just deal with what we've been given, and we're like, okay, I'm just going to go and I'm going to do this and I'm going to take the medicine and do the drug and, whatever. But I don't think any of us plan to be on any of that long term. So to have something that comes in that's natural, that it's non-toxic, it's a plant-based, it's not going to hurt your liver or anything like that. it's something you can take every day. I love that it's a part of your routine now. So
It
that's
is.
really,
It is.
yeah.
Yeah, absolutely. What I was going
Yeah.
to say was, the workflow in my practice, when a patient comes in, they say I have arthritis of the knee, and I offer them an array of options. If they have early arthritis, I say, listen, maybe an injection, physical therapy, and I say there's medications you can take. And I say one of my go-tos is the following, and I talk about Revive, and I let them know the ingredients, and it's natural, and the response I get is very positive, and the feedback is positive. And I think what people like is that they don't have to take another strong medication that may or may not interfere with what they're already taking, and they puts a smile on their face, and they try it, and they're willing to try something that's natural, and they appreciate that.
Yeah. Well, I know when I first met you in New Jersey, you would come to a presentation and you sort of saw more the fullness of the line. I would
Sure.
like to get like your expert opinion on kind of what you see that we're doing maybe differently or more unique, or what you really love about the way that Three produces their supplement line.
Yeah, I would just say the sourcing is very natural. You have a PhD level organic chemist who is very meticulous in his method and sources from all over the world. So I think, the origins are healthy, natural. I always tell my patients, like, everything that I'm showing to you is in the physician's desk reference. It's third party verified, so safe and healthy. And then in terms of offerings, there's so many offerings. Like, you can take a daily multivitamin with the pre and probiotics, and I think that sort of covers a lot. And people that aren't taking anything, who are older or maybe lacking, say, B12 is low or vitamin D or something like that, it's like you're covered. And I think there's something for everyone, and you can take, all the supplements. Part of them, there's certainly packages you can take that are beneficial. But what I like is that you have go-to options for vitamins, supplements, and then, in terms of nutrition, the collagen A, you have something that can help you with protein intake as well. And when I'm dealing with patients, it opens up what I'm able to offer them, and the conversations go a little bit differently. And it's actually really, really nice to have that option for them, that say, listen, there's nutrition, there's health and wellness, there's supplements for your joints, there is, Purify to help detox, and that's nice to be able to have that.
Yeah, and I like that it is somewhat simple. You know what I mean? Like
Yeah.
when I look at the other product catalogs out there that a lot of health professionals, if if they even have time to talk about it, right, to their patients, it's a lot. Like if you think of like
Yes.
Standard Process or Thorne, a lot of these other companies with these exponential catalogs of products, you know what I mean?
That's
It can be, that's why most doctors, they don't have time, right? But you're actually taking the time to have this conversation. You're able to do it more in a simplified way because there's really only six ingestible products, and you're
right.
probably
Exactly.
going deep into skincare, you know? So,
It's true. It's true. Like,
right.
I'm slowly working my way there. I certainly use it myself, but like I was saying, it's like I suddenly have more offerings as a practitioner. I have my orthopedic world, but it fits in very nicely. And I think patients appreciate it. I do. The extra 5 minutes you spend on nutrition, health, and wellness. I see, parents with children, I see elderly folks. And when you sort of capture all that population, I think it's something that is nice to be able to treat them and offer something a little bit differently.
Yeah. I mean, you're seeing the gambit, that's for sure, as far as different ages and different injuries and things like that as well. So, I mean, it's kind of amazing to me that in other words, I'm impressed that you're taking the time to do it. I would go see you if I knew. And so, I mean, it's such a testament to kind of who you are and how you're wanting to really like, not just like put a band-aid on something, but really pinpoint like a long-term approach to patient care, and being able to offer this fits in really well. So I appreciate it so much more than you realize, to hear that. Are there any stories or anything that's come up where you've, maybe had that initial discussion with a patient, they go and they purchase the product and they have a great result? Is there anything that like kind of stood out to you initially when you started first promoting, like, oh, hey, maybe this is good? Anything like that?
Yeah, yeah. So thanks. So I have plenty of patients that, they have pain everywhere, or when they have, say, a rheumatoid arthritis. And I have one patient in particular that I treated in the past for trigger finger, which is like when the finger gets stuck from inflammation. And then she says, my neck hurts, my shoulder and back. And then, initially when I would get that patient, it's like, what am I going to do? I can't inject everywhere, I can't operate everywhere. I can't always, use those tools. And so one particular patient who I've treated for years, I recommended the Revive product for her. She's a retired bus driver, a little bit older in her 60s. And in my mind, I was like, I hope this works. I just don't know what else to do for her. The steroids aren't healthy in large doses, injectable or by mouth. And so I ended up recommending Revive, and then the feedback was amazing. She said, I'm sleeping better, I feel better. She couldn't believe, how good she felt, and she wanted to buy more. She's like, I will buy this product. Thank you very much. And it's like, we have those, all doctors have those difficult patients who are like, what am I going to do? Like you're out of options. I can't use the surgical part of my practice because it's not surgery. You can't operate on inflammation, right? You have to treat it. And so I have that conversation with patients like, this is what we're going to do to treat your inflammation. This is an option. It's healthy. And in this particular patient, it was a home run. And I was very happy. And it just makes me more motivated to offer it to other folks where it's like, listen, this works. And give it a chance. I don't think there's a downside to it. It's all healthy, natural, antioxidants, anti-inflammatories. And I tell them, well, I think either I heard from you or from other folks that have like, you literally have to have 6 pounds of ginger and like turmeric to get what's in 2 capsules. Like the amount where you'd have to juice or chop up. And when people's eyes light, like, really? Because they spend their extra 30 minutes in the morning doing what they're doing. Is like, listen, take 2 of these and it'll knock that out. You'll actually absorb this as opposed to what you may or may not absorb from what you're taking by mouth or what you're ingesting, whether it's a liquid form or something like that.
Yeah, that is incredible. And you said something really unique. You can't do surgery on inflammation.
Right.
I
Right.
think there's a huge amount of the population who are walking around in an inflamed body,
Right.
they're not at their best health. They're experiencing symptoms that are due to an overproduction of bad inflammation in the body. And it's hard, nowadays to get everything we need and all the food that we eat and everything else. And so next
Right.
thing you know, you have symptoms, and you're like, okay, what do I do for this? How can I help? So I'm glad to see that she said yes, first of all. So obviously you're doing a good job of sharing because she's like, yes, I'd love to try. But more than that, what a beautiful result. What a beautiful story. I mean, that you just helped change somebody's life without having to perform a procedure.
Right.
So that's really neat. I appreciate hearing that. Anything else you want to share about why you love three?
I would say it's the results are there as a somebody who's been in practice for almost 17 years. Having this tool and using it myself, I like that. I use it myself. My wife uses it, and I have results from patients. So that really has captured my attention, and I'll continue to use the products. I think that's the biggest thing for me is it works for myself, and then it works for my patients. So certainly, I support three, and I'm glad I'm part of the team.
Mhm. You're a big part of the team, and we're so glad to have you. Something you just said too just kind of triggered me too. It's true, we can only do so much. I mean, I am obviously not a doctor in any way, shape, or form. My background is I'm at best an okay personal trainer, but I saw what you would see, where it's like you wanted to be able to help
Right, right.
much more. It's not like you can go home with your patient or your customer and be
Yeah.
like understanding all the facets of the way they live. You can only do so much. But I feel like when you're able to provide a supplement line that's clean, it's neat, it makes sense, there's no harmful ingredients in it, the science is right. You hit it right on the head. It is in the PDR. I know I checked the PDR. Did you
Yeah.
check the PDR?
Yeah, I mean, I have this big PDR, and it's like you lug it around, but it's all digital now. But yeah,
Yeah.
it's something that from time to time I will reference, and it's nice to know. And I tell the patient, listen, everything in here is in the physician's desk reference. It's here, it's in there. So I think it gives me confidence when I'm interacting with my patients.
I mean, yeah. I look back on my 20 years as a personal trainer, and there was a lot of supplements I promoted that were not in the PDR, that did not have the science backing. And I think that's kind of the world we live in. We live in a world where everything is digital and you can
Right.
buy supplements off Amazon, things like that, but they're not FDA regulated. They're highly under regulated in most cases. And I feel like the smart people, the health professionals, the doctors are looking for that science and those clinical studies to show that the products work. Was that important to you about three, seeing the studies as well?
Oh, absolutely. Yes. Having the science, being able, it's valid science, standing behind that is very important. Um, you know, as a provider, there's liability involved when you treat a patient, and it's like you want to have good results, and you want to be able to back what you're saying is truth and having science behind it. So having that is really important.
Mhm. Yeah, I agree. And so I'm glad that it was important to you too. Because I do think that there's a lot of people out there, they're looking for a quick supplement to try to help, but not all supplements are created equally. And certainly
Yep.
three, there's something to be said about the quality. And again, it's that, just because we have a plethora of supplements out there, it doesn't mean that they all work appropriately or that they're science backed. And so I'm so glad that you saw that. I mean, sometimes I think as health professionals, we are moving really quick too. And then, you kind of do have to do a little bit of discovery, but everything I have personally found on three is just, it checks every box. So I'm glad that it checks your boxes as well.
It
Um,
does.
so, okay, real quick, I have to ask, but I think I already know. What would your favorite product be if you had one?
Oh, well, it's Revive for me. I love them all, but I would say Revive. Just I had such a good response from it that yeah, I couldn't believe the way I woke up. And then one other little anecdote is like, I played 2 years of college basketball. I play recreational sports. I don't have as much, but that knee pain sitting in a car for 4 hours or a movie theater or on an airplane, that is virtually gone, like on Revive. I always find myself sitting in an aisle seat trying to stretch my leg out because my knee hurts. That's another benefit that I've seen, anecdotally, where I just don't struggle with that achy knee pain that's likely due to inflammation, a little wear and tear. And it's a subtle lifestyle change, but it's important to me because I don't think about that. I fly, I can take a middle seat now. I don't have my kids want the window and aisle, and I can sit in the middle, and it's not a big deal anymore. It used to be like, nope, I gotta sit on the aisle, move over because my knee hurts, but now it's not like that. So another benefit for me.
Yeah, okay. So it's creating positive change with the family while traveling as well.
Absolutely. It is. Not to fight over the aisle or the window seat.
Oh my gosh. Well, there's nothing worse than being in pain on a plane,
That's right. That's right.
This is not how many more hours do we have
I
here?
know.
Count down the moment. So, oh, I love hearing that. Yeah, the Revive is probably one of my favorite products as well. I mean, I love all of them because I see the different benefits that it brings to people's lives, but I do have to say, like, there's not a day that I don't take Revive. It's just not, so it's just nature's NSAID in its own way,
That's right.
it's beautiful. So, all right. Well, we have got some incredible stories to share with everyone tonight. So I want you to stay tuned, Dr. Lee, because I want to hear kind of what your thoughts are on
Sure.
what you shared too. So we've got Jeanine from Florida and Maria Rosado and Anita Hampshire, and they are together. And so we are going to start with Mia. Mia, are you able to unmute yourself and share exactly what happened when you started three?
Well, if anybody knows me, they know that I'm very into nutrition for years and years and years. And I like to go beyond the beyond. And when I saw what Dr. Dan puts in his products, I was so impressed because there are a lot of things that I buy and it diminishes like what's on your counter.
Mhm.
So basically, you get like all the things that I'm buying for so much less because each bottle is so expensive. But the thing was, I want you to hear my mom's um, testimonial because that was what really impressed me more than myself because she's a great one to put things up against. So, and I loved what Chat GTP said about three when I looked. I said, where does it stand in supplements? And it said it stands by itself. And I mean, you should look it up, but um I asked about certain things like Hashimoto's and different allergies that friends have. And it said there was only one thing in one product that Hashimoto's, they said it was iffy.
Mm.
But basically, I just feel like Dr. Dan really is amazing at choosing what he chooses to put in there. The technology is incredible. I just noticed, I don't know if you heard about, I don't know if my camera was frozen, but I just can't believe the happiness I have. And I have so much energy. I feel like I've taken 3 cups of coffee in the morning without the jitters. And I'm actually losing weight. Um, Purify is amazing because I love how it works on 5 organs throughout the night, where you're going to have your skin, your heart, your liver, your kidneys, and what's the other one? There's one more. liver, kidneys, and there's one more. Anyway, but it's really nice to know that you're cleaning yourself out, and it's very gentle. It doesn't, and even if it's rough at first, it's gonna balance out. And that's what I'm finding with most of these products. And we've only been on them for like almost a month. So I mean, it's incredible to see such changes. And I saw changes in her the first day.
Yeah,
I
let's hear
saw
from
her come to life, like her. All right, I'll let her talk.
No, you could. Your mom
Okay.
came to life. So you're feeling more energy. You feel like
Mhm.
you're having 3 cups of coffee without having the cups of coffee. That's really good.
Right,
You're
right,
losing
yeah.
a little bit of weight in a month. That's huge. And you love
Mhm.
the detoxification parts of the product. So I loved hearing that, Mia. That was beautiful and amazing. Like, thank you so much for sharing your personal story on 3 so far. I mean, it's only been a month, right? So
I'm not done. I mean, there's collagen that really works. I mean,
yes.
it's just, I just love each product. So
Wonderful. Yes. Well, I'm excited because I know when you originally reached out to you, you're like, my mom has an incredible story. So I would love to hear how your mom is feeling on the 3 products as well. Hello, Anita.
Hi. Um, in the last 4 months, I was in the hospital 7 times. I had 2 surgeries and cellulitis, a whole bunch of stuff, and really sick as a dog. I heard Mia talking to Elizabeth, and I loved it that the 2 girls were, discussing all this nutrition and these things. And then Mia started to take these supplements, and I noticed in her grumpy face she was smiling. She actually started to smile. And I said, what is in this stuff?
Yeah.
And of course she said, Mom, you've got to try this. And so I did one. I tried each one the way it's supposed to be taken. And I have to say that when I get up in the morning, I don't have that stiffness. Well, it's not all gone, nothing is going to create a miracle except God. But the thing is that it really has helped me. I don't have that stiffness. I'm happier than I was. I mean, consider where it was coming from since January. All that pain, terrible pain, and it's really been diminishing. And I think it's because there are things in the 3 formulas. When I say 3, meaning the name,
Yeah.
when I really feel that there are things in there that my body was missing. It was not in my intake, and I take a lot of medication, high blood pressure, you name it, I got it.
Okay.
But my hair, my nails, my skin. Sometimes people look at me and they go, "You don't look 78." Well, that's very nice. It's got to be attributed to what I'm putting in my body, because it's making me feel good. So therefore, it comes out in your skin, which is another organ. So I'm feeling, and then being a woman, you know how we are. If we look good, we're happier.
Yeah.
And these supplements are absolutely helping me. And I mean, I'm 78. It's not too late. It's not
Ah,
over till it's over. So, I was having, um, uh, and I went in with a very high expectation. And I have to say, I have not been disappointed.
Oh, I love hearing that, Anita. That is beautiful. Thank you so much for sharing that. You guys, the happiness, yes, when you feel good on the inside, it does show on the outside. And that is a result that sometimes we hear, right? Quite a
Yes.
bit, because we start to feel good. You know, Mia had said, I'm so happy that my mom is happy. She's like, it's like somebody turned all the lights on and she's been through a lot. And so you guys, thank you so much for sharing that with all of us in the world of three, because you are absolutely right. It is not too late to feel good, right? We always want to keep pushing forward. Dr. Lee, what do you think about that?
Well, she sounds like one of my patients. I treat patients who are in their late 70s, and I'm happy Anita is improving. So, what it sounds like to me is that maybe there's some underlying inflammation or some pain. Cellulitis is an inflammatory and infectious process in the skin that infiltrates the skin. It's very painful. It's red, angry tissue. And if you're able to calm that down, usually through, antibiotics and anti-inflammatory, and if you're using products that help you with that and help you with your nutrition, then it certainly will make you feel better and hopefully keep you out of the hospital. I think that's, if I met you in my office, that's what I'd want you to do, is stay out of the hospital. And if you're able to supplement appropriately, give your body what it needs, then the chances of you going back are hopefully less than they were before you were on it.
Oh, beautiful. Yeah, that was so great. Well, thank you, ladies. Stay on. Don't turn your camera off. Stay here with us. Okay. All right, Jeanine, all the way from Florida. We would love to hear your three story. Like, what happened to you when you started three?
Well, it was in June of 2023, and I had just turned 70, and I was in a lot of pain. I have osteoarthritis. I had back pain. I have arthritis in my back, and also some curvature of the spine and that sort of thing. And I was overweight. And I was facing the possibility of surgeries for my knees and gastric bypass surgery. And I just did not like the idea of doing the surgeries because I've seen, people go through a lot after surgery, and sometimes it works, sometimes it doesn't, and you end up with more complications. And so I was introduced to the products, and I had listened to Dr. Dan describe things, and I really was impressed with the science three. And so I'm like, I'm going to try these. This is it. And I have to say, within a few weeks, I was amazed at how much it helped my knees, because I was getting shots in my knees too, but the in between time when you're waiting to get that next shot, because you can only have so many, it would be painful, and I would have to take all this, pain medication. And with the Revive and the collagen, that stiffness and that pain went away. And I really, in between time of shots and stuff, I'm much more mobile. I can get up and down stairs, up and down, sitting in chairs or sitting for prolonged times. It's up easier to get up. And then, of course, I'm taking all the products. So my energy is up, and I lost 17 pounds in the first 3 weeks I was taking this. So all the surgeries are off the table now, which I'm so happy about. Now it's been almost 2 years, and I've lost a total of 55 pounds because I've stayed on the products and adjusted my lifestyle. But it really made all the difference for me. I'm much happier and healthier and energetic. I sleep better. I just can't say enough for these. They've really made a huge difference for me.
Wow, Jeanine, that was amazing. Like, congratulations on all of your success on the product line, because it's never a guarantee, right? We put things in our
No.
body that work. And for you, it's been working amazingly. So yeah, Dr. Lee, what are your thoughts on that story?
Yeah, another success story. Really reinforces my use of Revive for myself and my patients. And I think for Jeanine to have that response, especially with multiple areas in her body where she has degenerative arthritis, which is painful, losing the weight, changing the lifestyle, all really good things. And as a surgeon, that's part of what I do is knee replacements. But if somebody says, Dr. Lee, I took these supplements and it worked really well, I'll see you when I see you. I mean, that's actually a success story. So I'm happy to hear it, and that's great news.
Awesome. Oh my goodness. You guys, that was so wonderful. I know that we probably could go on all night chatting about three and all the amazing things three is doing for us, especially because we're all so happy while we're on it. And that's true. I have to say myself, when you said the first result is happiness, I'm like, me too. I was just all of a sudden, I was like a calmer, happier person. So I think maybe we're all walking around like dehydrated houseplants. We need more water and we need better nutrition, right? That's amazing. Well, Dr. Lee, you have been phenomenal tonight. Thank you for sharing with us why you love three so much from your expertise and from all the results that you're seeing in your office.
You're welcome.
And thank you, ladies, for allowing us to sort of tap into your world and how three's been supporting you. And we can only hope for better results in the future moving forward. So everyone stay on your products. And I invite all of you who are on, all of you, okay, who are on tonight. There's 114 of you. I invite you to join us on the next Wellness Wednesday. So every single Wednesday, we feature incredible, health professionals who are in the world of three. There's over 3,000 active health professionals in the world of three. A lot of that is because our products are vetted and they're in the PDR. So we're grateful for all of those people who are saying, yes, there's something to this. This is a good thing. And then there's new testimonials you get to tune into every single week. So we will see you all next Wednesday. And thank you guys so much for being on with us. Bye-bye.
Thank you.